Hello, my friends. I'm Dr. Susan Parker, urologist and specialist in men's health after 50. And today I want to talk with you about something that almost no one questions, but that can quietly affect your bladder, your prostate, and even your confidence in daily life: peeing while standing. For many men, this is not just a habit, it's a symbol. Real men pee standing, right? You learned it as a boy, you never questioned it, and it became automatic. But what if I told you that, especially after 50, this habit may no longer be your ally? What if something as simple as the way you position your body in the bathroom could be contributing to weak flow, dribbling, nighttime trips to the toilet, and that uncomfortable feeling of never fully emptying your bladder? That's exactly what we're going to explore together today. My goal in this video is not to tell you that standing is wrong or that you've been doing it badly your whole life. My goal is to put science, anatomy, and experience on the table so you can make a conscious choice about what's best for your body today, not what made sense when you were 20, because your bladder at 55, 65, or 75 does not behave like your bladder at 25, especially when the prostate begins to enlarge and the pelvic muscles lose some of their natural tone. Let's start by understanding what actually needs to happen in your body for you to urinate well. Every time you go to the bathroom, 3 structures have to coordinate like a well-trained team: the bladder, which is the reservoir, the urethra, which is the tube, and the pelvic floor, which is the muscular hammock that supports everything and controls the opening and closing. When you urinate, your brain sends a signal to the bladder to contract and to the pelvic floor to relax. It sounds simple, but that balance is delicate. If any part of that system is tense, blocked, or compressed, urine flow is affected. Now let's add an extra protagonist to this story: the prostate. Around 50 and beyond, the prostate commonly increases in size. This doesn't always mean cancer. In most cases, it's what we call benign enlargement. But even benign enlargement can press around the urethra like a hand squeezing a straw. The result? Slower stream, difficulty starting, the need to push, the sensation of incomplete emptying, and sometimes drops that appear minutes after you've finished, especially when you walk away from the toilet and are already adjusting your clothes. Here's where posture comes into play. When many men pee standing, especially those over 50, they unconsciously do something harmful. They push. They tighten the abdominal muscles, hold their breath for a moment, lean slightly forward, and try to squeeze the last drops out. They think they're helping the bladder, but what they're really doing is increasing pressure inside the abdomen while the pelvic floor remains partially contracted. It's like trying to squeeze a tube of toothpaste while your fingers are still pressing near the opening. The pressure rises, but the exit is not completely open. Over time, this pattern can train your bladder to work against resistance instead of in harmony with relaxed muscles. The bladder wall thickens, becomes more irritable, and reacts with urgency and frequent urges. Meanwhile, the pelvic floor gets used to staying tense and doesn't fully relax when you need it to. The combination of these factors often shows up as a weak stream, intermittent flow, dribbling after finishing, and the famous, "I just went and already feel like I have to go again." Now imagine another scenario. Instead of peeing while standing, you sit. In a seated position, especially with your feet flat on the floor and your back supported, your pelvis tends to tilt slightly in a way that favors relaxation of the pelvic floor. The abdominal muscles don't feel the same need to push. Your body receives the message, "We're safe, we've got time, we can relax." For many men over 50, this change alone allows the bladder to empty with less resistance and less need for force. Several of my patients describe the first time they tried peeing sitting down as a surprising experience. They say things like, "I didn't realize how much I was pushing before," or "I felt the stream was more continuous and relaxed." Some notice for the first time in years that they finish without needing to squeeze out just in case there's more. And many report a reduction in that annoying post-void dribbling, the few drops that show up when they think they're done. Another key point is nighttime urination. After 50, it's common for men to wake up 1, 2, or even 3 times at night to go to the bathroom. Sometimes this is due to prostate enlargement, sometimes to fluid intake late at night, and sometimes to bladder overactivity. But what many men don't know is that incomplete emptying before going to bed can be an important factor. If you habitually pee quickly and standing, making some effort, you may be leaving more urine inside your bladder than you think. That leftover volume increases the chances that your brain will get the alarm signal sooner, waking you up to go pee again. When these same men begin to sit down at least at night, relax, take a few extra seconds and allow the bladder to empty more fully, some of them report a very practical benefit: fewer nightly awakenings. Not in every case and not like magic, but quite often. And if you're over 50, you know how valuable 1 extra solid hour of sleep can be for your energy, mood, circulation, and even your intimate confidence during the day. Let's also talk about something that no one likes to mention, but that matters: hygiene. When you pee standing, no matter how precise you think your aim is, there is always splash. Tiny droplets reach surfaces you don't see: the toilet edge, the floor, your legs, sometimes your clothes. In public bathrooms, this is obvious. At home, it's simply more subtle. Over time, those small splashes contribute to odors, stains, and a sense of less cleanliness in the environment. For men with prostate enlargement, whose stream can deviate or split, the problem is even greater. Sitting dramatically reduces spray and helps keep the bathroom cleaner, which your partner and your future self will appreciate. Another aspect we need to consider is stability and balance. After 50, and especially after 60 or 70, it's more common to live with knee pain, hip stiffness, balance issues, or dizziness when standing up. Urinating while standing may seem easier, but it can involve subtle risks. A small dizzy spell, a misstep on a wet floor, or a sudden need to turn quickly can be enough to cause a fall. And a fall after 60 is never a minor event. In a seated position, your body is more stable. You remove the risk of slipping and reduce the tension in your joints. It's a simple way to add safety to a daily act you perform several times a day. At this point, you might be wondering, "But doctor, is standing really that bad? I've done it my whole life." The answer is not black and white. If you're a young, healthy man with strong pelvic muscles, no urinary symptoms, and no prostate enlargement, peeing standing is unlikely to harm you. The problem arises when age-related changes appear and you keep using the same strategy your body learned 30 or 40 years ago, ignoring that the terrain has changed. What was neutral at 25 can become a disadvantage at 55 if you now have a larger prostate, less elastic muscles, and a bladder that has already been strained for years. I want to share with you the story of a patient, I'll call him Robert, who came to see me at 62. He complained of weak flow, urgency, and the need to return to the toilet minutes after finishing. He had started to wear a small pad, just in case, because he was tired of discovering damp spots on his underwear a few minutes after leaving the bathroom. His tests showed a moderately enlarged prostate, not dangerous, but definitely influential. When we evaluated how he urinated, one detail stood out. He always stood, pushed hard with his abdomen, and tried to empty everything in 20 seconds or less. We didn't start by prescribing medication. Instead, we worked on his habit. I asked him to sit whenever possible, especially at home and at night. I taught him to place his feet flat, relax his shoulders, breathe out gently when starting to urinate, and resist the urge to push. In the first 2 weeks, he simply noticed that the process felt strange and slower. But around the 1-month mark, he realized that he was no longer rushing and that his post-void dribbling had reduced. At 3 months, he reported that he was going to the bathroom a bit less frequently, and that some nights he only got up once instead of twice or 3 times. His prostate did not shrink miraculously. What changed was the way his muscles and bladder cooperated. Another man, David, 71, had a different story. He didn't have a major problem with flow, but he was terrified of falling. He had already slipped once in the bathroom at night. The floor was a little wet, he was half asleep, and while turning to flush, he lost his balance. Fortunately, nothing was broken, but the scare left a mark. We talked about the option of sitting down at night as a routine for safety. He accepted reluctantly at first, because he felt it was less masculine. Within weeks, his perspective changed. He felt calmer, more stable, and ironically, more in control of his body. That peace of mind is also part of your health. You might be thinking right now, is this about masculinity? And I want to be very clear. Your masculinity, your worth as a man, your ability to be a strong presence in your family and in your relationship have absolutely nothing to do with the angle at which you urinate. They're linked to your responsibility with your health, your capacity to adapt, your willingness to protect your body as you age. Choosing to pee sitting down when it helps your bladder and your prostate is not a sign of weakness. It's a sign of wisdom. So, practically speaking, how can you experiment with this without feeling awkward or forced? Start at home. Choose moments when you're not rushed. For example, before bed or first thing in the morning. Sit with your feet flat on the floor, not on tiptoes. Support your back if you can, or lean your torso slightly forward from the hips, not by hunching your shoulders. Relax your jaw and shoulders. Yes, that matters, because tension tends to travel through the body. When you feel the urge to pee, let the bladder do the work. Avoid holding your breath or tightening your abdomen. If you notice that the stream stops and starts, wait a few seconds instead of pushing. Often, a second, more relaxed wave of flow appears on its own. Give your body at least a few weeks to adapt before you judge the result. Habits formed over decades don't change in 3 days. Observe not only the strength of the stream, but also how you feel afterward. Do you still have the sensation of something left, or do you feel more complete? Do you notice fewer drops when you stand up? Does your nighttime pattern change even slightly? Small improvements, repeated daily, add up to substantial changes over months. It's also important to say that sitting will not solve every urinary problem. If you have burning, visible blood in the urine, intense pain, very sudden and strong urges, or a stream that has severely weakened in a short time, you need a checkup. Sitting can help your muscles and bladder cooperate better, but it does not replace medical evaluation when there are alarm symptoms. What it can do, in many cases, is reduce the strain on your urinary system and complement any other treatments you may need. If you're already on medication for prostate enlargement or have undergone a procedure, adopting a more relaxed and stable posture to urinate can support your results. Some men, after surgery or minimally invasive procedures, still maintain the aggressive habit of pushing while standing. Their bladder has not yet unlearned that pattern. Teaching the body a calmer, seated posture can be part of the rehabilitation. Less friction, less pressure, more harmony with the changes that have already been made medically. There is another subtle benefit I want to mention: the opportunity for mindfulness. We often treat the act of urinating as a hassle, an interruption, something to get over with quickly. But every time you go to the bathroom, your body is giving you information about your hydration, your bladder health, and your prostate state. When you sit and allow yourself a few more seconds, you reconnect with those signals instead of ignoring them. You notice if the stream has changed compared to last month, if the color is too dark because you're not drinking enough water, or if your bladder is asking for attention in a different way. That awareness can lead you to seek help earlier when something is not right. For men in their 50s, 60s, and beyond, urinary health is directly linked to quality of life. How you sleep, how confident you feel when leaving home, how relaxed you are in a long meeting, how free you feel to enjoy a trip without constantly scouting for the nearest bathroom. Changing the way you urinate may sound like a minor detail, but details matter, especially when repeated several times a day, every day. If today you're dealing with frequent urges, weak flow, dribbling, or nighttime awakenings, I'm not promising that sitting will magically fix everything. That would not be honest. What I can tell you, both from physiology and from years of practice, is that for many men over 50, the simple act of sitting to pee reduces strain, favors more complete emptying, and contributes to a calmer, more efficient bladder. It is a no-cost, low-risk adjustment that you can test in your own body and then decide whether to keep or not. So let's summarize the heart of this message in one sentence. After 50, the smartest way to urinate is not the way you learned as a child, but the one that best respects your current bladder, prostate, and pelvic floor. And for many men, that means giving sitting a real chance. Your health is not frozen in time. It evolves, and your habits should evolve with it. Remember this: you are not less of a man for adapting. You are a man who takes his future seriously, who wants to sleep better, move more confidently, and preserve his intimate well-being for as long as possible. It is never too late to change a habit if that change protects your body and improves your daily life. If this conversation resonated with you, I invite you to reflect tonight, in the privacy of your own bathroom, on how you want to treat your body from now on. Try this small experiment. Observe how you feel over the next few weeks, and if you notice improvements, share your experience with other men in your life. Many of them are silently dealing with the same difficulties and have no idea that something as simple as posture could help. And if you'd like more guidance on prostate health, bladder habits, and strategies to maintain your vitality as you age, I'll be here, sharing clear, practical, and respectful information. Don't forget to subscribe, leave your questions or experiences in the comments, and share this video with someone who might need to hear it. I'm Dr. Susan Parker, and I'll see you in the next video, where we continue learning how small, intelligent choices today can protect your health and independence for many years to come.